before we go, can you briefly talk about your experience today?
Yeah. I feel like maybe a little bit more comfortable choosing various or giving my patients maybe better information what to look for their specific symptoms like nausea, pain control, and maybe sleep.
I'm Dr. Janice Makela, and this is Dr. Jennifer Ron. If you could tell me a little bit about yourself.
I'm an integrative cancer care physician, and I was an emergency physician for 25 years, and I pivoted when I had a medical diagnosis and went back and trained in integrative medicine. Now I'm boarded in that. And I also have taken some naturopathic oncology courses, specifically with Naisha Winters. And I am very interested in using more natural products for my patients rather than, recommending a chemical or a pill or something for various, issues such as nausea, sleep, or possibly pain control. So cannabis is, of interest to me in helping my patients heal.
Before we worked together, what were you feeling stuck on?
I guess I just wasn't comfortable with, deciding what form of cannabis to recommend to the patients. Now, with a little bit of discussion, I really didn't know much about a tincture. That was something that I learned about from you that would be very helpful, especially for a nauseated patient. And that, we could use the flower also of the THCA plant to make a tea as well.
And what made you decide to do this here?
Oh, for that exact reason. I would do anything to make my practice better for my patients. And I feel that any form of education about anything that will help my patients is something I'm going to say yes to.
And what's the most helpful part of this for you?
Getting over the hump of learning, later in my career, like that cannabis maybe is more helpful than a lot of other products that are more harmful. And
yeah. And how do you feel now compared to before we started?
More confident. And I've got a whole page of notes that I'm gonna
awesome.
to condense into so that I have a little bit better way to look up what we learned today.
Awesome. Yeah. Is there anything that feels cleaner or easier for you now?
Yeah, I mean, as we discussed, I think the tincture is a great idea. I never really even thought of that. That wasn't even a thought in my mind. Also, I have a suggestion for a topical CBD from you, which I'm going to look into as well for my patients. And as you said, I can look up, you gave me a Penn State Pharmacology they have a website where I can look up any interactions. And so that's a really good resource as well.
And where do you think right now you'd be if you hadn't taken this course here?
Still wondering what I can do to help my patient.
And if someone's considering working with me, what would you say to them?
Well, I would love to work with them. And, I have a pretty open mind. I will use as many tools as possible to help them heal. Cannabis is a natural product. And so I feel more comfortable recommending a natural product versus, recommending another form of pain control, such as opiates or, Ambien or trazodone for sleeping. Those are not things that I would endorse. So to use a more natural product is definitely something that I would recommend.
And if someone was considering my course or program working about cannabis, what would you recommend to them?
Yeah, I think it's great. I mean, I think, the more knowledge you get, it's a very confusing time where we have this really great product available. There's not much studies on it. So we have to look to the experts that are out there who use it. And you're one of those. So I would advise people to, tap into the experts and, learn from them.